I was experiencing a bunch of pain with my right hip, and so I decided to get surgery to replace my hip. Wasn't using it very much, right? So when you walk, you are in pain. Taking a lot of aspirin or ibuprofen and that sort of thing to kind of soften the pain, but nothing cured it. A lot of pain. Most people at 47 don't get their hips replaced. So I decided I was in enough pain, I needed to take some action. And I'd put it off for 3 or 4 years and decided, hey, let me see if I can manage with the pain. At some point you have to decide how much pain can you deal with. My doctor, Dr. Dalton, referred me to Parham Doctors Hospital, this facility, and I had the surgery done here. HCA organization actually has a very succinct process. Made you feel very comfortable. I came into a room very similar to this room, and we had an educational course prior to surgery. I had a booklet that walked me through every stage of the process. The nursing staff and the doctors were very much, communicating to me, letting me know the process. I was already prepped. I knew what was going to happen. The very same day after surgery, after I could, speak and possibly walk, I actually got up that same day. And I walked down the hall, turned around and walked back, and got back in the bed. And then from there, the next day I was released. I had to go through a couple of classes, trained me how to walk up and down steps, how to walk with either crutches or a walker. I chose crutches, and I felt very comfortable and left pretty much the next day. Nurses knew what they were doing, and they paid attention to what I was going through, and they experienced it before, so they knew what to do and what to say, and also to keep me kind of in the rhythm of healing. The pain level has actually been very minimal. I think you get some shadow pains, some getting used to things, but really in terms of pain, 0 is where I've been. And I'm a year later and I can actually run, I can play basketball, I can go to the gym and work out, I can be physically fit. And now I'm deciding, do I want to get my other hip done within the next few years to decide if I don't want that pain anymore. Prior to surgery, I couldn't even walk 5 steps without being in pain. Now I can run, I can jump. And so really what I'd like to say that anybody that's considering it, you need to strongly consider doing it because it has changed my life. I can run, I can play basketball. Anybody that has a fear wrapped around getting their hip, especially the hip, because I've got experience with it, it was a great process and it changed my life. So there's actually 2 people that are close to me that I've already identified, and I said, hey, you need to get this done. And I said, if you're gonna get it done, I've got a great hospital and I've got a great doctor that I can refer you to.